Welcome everyone to the training webinar series Eyefinity Encompass Master Contact Lens Essentials from Assessment to Care presentation. Thank you for joining us today. We look forward to your questions throughout the presentation. You can enter your questions by clicking on that Q&A icon on the top of your screen. My name is Linda Park, and it is my pleasure to be with you today to introduce Tina Sanchez. Tina has more than 10 years of healthcare experience and has been with Eyefinity for 6 years, where she has an expertise in Eyefinity Encompass. She holds a master's degree in healthcare management and was born and raised in Savannah, Georgia. Tina loves to read and travel in her spare time. She is known for her enthusiasm for helping others. Welcome, Tina.
Thank you, Linda, and thank you everyone for joining. So let's dive in and let's talk about, patients that are coming in, and they're there for maybe a routine eye exam and they will, end up getting contacts or, or glasses sometimes or, both. So I'm going to go ahead and bring over my practice management screen. So we're going to start on the practice management side because that's when, the patient comes in, we're going to check them in, for their visit. So I'm going to go to my appointment calendar and we can see my Rachel Ray patient is scheduled and I'm going to check her in. I've already checked everything on her and, just like you normally do if you are, part of the front office staff, when you check in a patient, just to ensure, we have her insurance, if she has any, has the authorization documented, because my patient does have VSP insurance. And if you guys don't know, just to give you a little quick tip here, when you're on the appointment calendar, if I do want to pull up where the authorization is, I can click on the Head and Shoulders picture here and click on eligibility authorization, take a look, and I can see for my signature, I do have an exam authorization, contacts, contact lens services. This is just a quick way to get to that instead of having to go back to the front office area away from the appointment calendar, maybe to pull the authorization here if you hadn't done it yet, or if you just want to view it, make sure their insurance is there, their authorization. You can do it right here on the screen. So I'm going to close this out and then I'm just going to mark my patient as checked in here. And, that's according to the, the process of your office as, you're marking them as checked in, checked out, what your workflow is as to how you're handling patients when they, walk in for their appointment. So I've checked in my patient and now, they're going to go back for their pre-testing. So now I'm going to jump over to my EHR side. So when they are checked in, they're back there and they get called back for their appointment, then I'm going to go up to my quick list and I'm going to create the visit from here. So you can see my visit that has been created for this patient. I'm just going to create a visit here to open up my visit for today. And I'm just going to run through an entire visit today, but I'm going to point out some key points when it comes to completing a contact lens exam to ensure that you're getting the appropriate coding, that you're getting, that code for your contact lens fitting, that you're, the doctor's putting the assessment, how those contact lens trials, if you're giving that patient a trial lens, how those contacts fit, when that patient puts them in their eyes in your office and the doctor looks again to see how those are fitting. So I'm going to go ahead and add my chief complaint here. And I'm going to say they're here for a routine eye exam because my patient is an established patient. So they're just here for a routine eye exam, their yearly exam. Now, I didn't do anything with copy forward or anything. Of course, you guys probably know that I can copy forward from a previous visit. If I saw the patient last year, I can just go and copy forward everything from that previous visit. I'm starting out from scratch here, not copying anything forward. So then I'm gonna, okay, we did that. And then here is, my chief complaint area. So I can fill in my details of my chief complaint. And I'm going to say this is a routine exam. They're here for exam for contact lenses, because maybe that's exactly what they're here for. They're like, I wear contacts. I want to get, have my exam and, get contacts. Or maybe they've never wore contacts before and we're, giving them contacts for the first time. So then, like I said, you're just going to answer these as you normally would, if anything is pertinent to this patient today. I'm just going to answer those first two and I'm going to save it. Then you see my chief complaint there. Then I can still go to my review of systems, just like I normally would. I'll go ahead and do this. Say everything, let's see, yeah, they have blurred vision. That's still the same. I'm going to go mark all reviewed and save. So, and then let me save and continue over here. All right, so I'm going to go back out to my visit here to bring me back out to my main screen in my visit. So we should see my review of systems there as well. So now I'm going to jump into my vision summary section. So I'm going to add my test. I'm going to go ahead and jump around on here and add in things. So mark pupils, motility, visual fields. Keep in mind you can do that at the same time. I'm going to click that here. So that does those. I'm going to jump in and do my IOPs here. And let's say they have like a 13 on both eyes. I'm going to save that. Then visual acuities. I'm just going to pop something in here. I'm just going to say, I'm just going to put that in here and save it. So of course, you guys know I'm making up numbers here, but you're going to document, what the acuities are for the patients, what their IOPs are. And then you can see I have my green bar here already since I documented all 5 of those asterisk items. But now let's go in, let's put in the refraction. So of course, you may have equipment that's going to pull this in. I'm going to manually input my refraction here. And then I'm going to go ahead and put this patient's prescription. And I'm going to, of course, make this up. Just choose something. And actually, I'm using my own prescription here. So, all right. And then I can always copy over. And if something's different, for instance, this is a little bit different, then I'm going to change this. Yep. And make my changes as needed. Okay. And this is down. Okay, so I have my refraction in here. I'm going to save it. And I'm going to point this out here as well for anyone does not know this, even though we're focusing on contact lenses. This is a great thing to be pointed out, this auto generate. If anybody on this call is not familiar with this, make sure if you want the system to auto generate that diagnosis along with these plans, have that checked off. You only have to check it off one time because you can see this is a sticky feel here. So once that's checked off, it's going to auto generate the diagnosis for me based on my prescription or my refraction here. So I'm going to save this and I'll show you how it does it. So I have my refraction in. There's my refraction here on the screen. And if I scroll down, you can see I have myopia with regular astigmatism and presbyopia. And then it puts in all my plans here. So awesome feature in here. If you're not using it, definitely look into that. Because it, will generate any of your refractive disorders. And as you see, it looks at the prescription and, says she has myopia, but she also has regular astigmatism and presbyopia. So but let's go ahead and go back up here. And now I want to focus on, first of all, putting in that trial lens here into EHR. So I'm going to go back to my add test and I'm going to go to soft contact lenses. So we always have to have a usage up here for your contact lenses. So if I'm like multifocal, it's up to you if you want to use it here. I like the statuses, especially if, maybe the doctor gives the patient a trial, has them put it in, and it doesn't work for them. I like that you can put dispense unsuccessful here, because then if the doctor goes back later next year and is looking and maybe looking at giving them a different trial, then he can go back to the list and say, oh, yeah, this trial did not work for them. So when it's, when you have the status of dispensed unsuccessful, and the same thing with dispensed successful, be like, that's a trial that worked for them. So it's up to you. It's not a required field, but I really like that list. And then we're going to go down here and select our manufacturer. And let's see, I'm going to use Bausch and Lomb here, my product. Let's see if I have on here what I want to. Okay, let's say we're going to do this one, and then we'll put in our sphere. Let's see, put in our sphere here, and it fills in the rest for me. So I'm good to go there. I'm going to copy it to the other eye. I can make adjustments as needed. I'm going to say it's the same on both eyes with these contacts for this example, but you can definitely, update these things and change anything as needed. In the sphere diameter, you can see in these cylinder axis, this add power is not letting me choose something based on what I selected here in the product. Because this is not, I chose multifocal up here. You may be like, wait, that's not a multifocal. I didn't have the multifocal available in my product dropdown. So, but I just selected, something here. If I was like, oh, that's the wrong one, I could just go back and look for the right one. So let's see. I'm not sure about the rest of these. I'm just going to leave it like this. So we have our prescription in here. Now, when the doctor is putting this in, now this is not a trial lens. This is a good example here because I didn't choose a trial lens. But if I'm like, oh yeah, this is a trial, I want to document it as a trial. You can see anything with a DX here, DX. That is your diagnostic lenses, your trial lenses. So I'm like, this is a trial. I'm going to change that to that trial lens because I wanted it to be documented, as a trial lens in here versus the regular contact lens that I would be selling, to my patient. So I have that in here. Now, where does the doctor put the assessment? How are these trial lenses fitting? Now, I'm going to save this because maybe at this point, when the doctor puts these in here, they're not ready to put in, how those trials are fitting. Maybe they just put the prescription there and now the patient is putting them in, and then the doctor's going to come back in and look at them to see, how they are fitting. So this one piece that we want to make sure that we are documenting, for your coding, because we want to make sure we put that assessment in here. Even though we're going to go add a plan to create a code for the fitting, we still want to make sure we are documenting that assessment somewhere. And this is where we want to document it here in the vision summary section. So I'm going to go back to my trial lens. Here we can see my trial, and I can go and click on edit here. Brings it right up on my screen here. I don't have to go to a different screen. It just pops up for me. And let it load. For some reason. All right, so here we're on the detail screen at the moment. That's where that prescription was. And you see here at the left, we have this assessment and contact lens regimen. So this is where we want to document that assessment. When the doctor is wanting to put in there how those trials are fitting, in the patient. Are they working? Are they comfortable with the movement of that? If there's any, toric rotation they need to document, this is the screen we're going to document it on. Now, pretty neat, we have a little mark as normal button here. So if everything is normal, you can click on mark as normal. It fills in everything as good and comfortable for you. Now you can go here and choose like toric rotation and rotated if that's needed. And then I can also put my degrees here if that's something that's needed on that contact lens assessment for those particular contacts. Now you can see I have drop downs here as well. If it's tight, loose, then you can, decentered, all of that, you have those options here. But if everything's normal, just click on this mark as normal button and the assessment is done. Now it's up to the doctor if he or she wants to put a wearing schedule, replenishment, disinfecting here. You have the, options to choose those things as well here. But definitely want to get this assessment in, how those contacts are fitting. And we can put assessment notes here. If there's anything additional that the doctor would like to put here about this, assessment of how these contacts are fitting, just put it into this box here. And then I'm going to save it. And if we look back at my trials, you can see there's my assessment here on my screen as well. Now, for my patient, I'm saying, for my example, I'm like, this is the first time this patient is getting contacts. So the doctor is going to, send them home with these trial lenses and have them come back in for a follow-up. Or you may have a patient that sending them home with trials and say, okay, give us a call, let us know, if that they're working. So then we can order, get your contacts ordered for you. So I'm not going to create a Final RX today, but you can go and create a Final RX. Now, I do want to remind of one thing. Remember, I put diagnostic lenses here. So whenever I go to create a Final RX, so I'm going to create it just so you see it. So when I create a Final RX, it immediately creates that Final RX for contacts. Unlike with classes, when you create a Final RX, it just opens up a screen. So then you can make any changes as needed on that final. But when it comes to a contact lens prescription, then it immediately created it with this diagnostic lens. Because that is the trial lens that I put in. So if we create a final prescription from that trial lens and we've selected a trial lens as the product, then once we create this, we will want to edit, not right away send it. We want to go in there and edit it and, change this product so it's not the diagnostic lens. So then I would just go in here and be like, okay, it's the Ultra 6-pack. And just update it and then save it. Oh, and we'd have to we'll change it in the other eye as well because it did change it. Good. So it changed it in both eyes for me, but just make sure it's changing in both eyes to not have that diagnostic lens on there, especially if you're going to send this prescription over to the, front office for your staff to, maybe give that prescription to the patient or order those contact lenses. We need to order the regular ones unless you're going to order, trial lenses for that patient. Then absolutely send that over with the diagnostic lens. All right, so that is the assessment plan there. And so now we're going to move on down to our exam area. So I'm going to pop into our exam, go ahead and perform exam, and actually I'm going to use my simple eye exam just to pop in my cup to disc ratios. This is a straightforward, routine exam here, and then I'm just going to put in my cup to disc ratios. See, they have 0.3, and maybe I didn't do a dilated exam today, so I'm going to click on done. My exam's in there, everything's normal with my cup to disc ratios. And then now I also have my myopia diagnosis down here that auto-generated from my refraction area. Now, let's talk about these plans that are on this myopia diagnosis. That's great that it did this, right? It automatically populated all of this for us. Now we can always come down here and make edits as needed. So for instance, I have my follow-up from next visit refractive optometry. It's blank here. It doesn't say I'm going to follow up with them in a year when it's time for them to do their next routine exam. So I'm going to resume that. Go up here, put in my year follow-up, and click on done. All right, and then one thing I'm missing here. Now, you guys, some of you may be using, protocols that are here on this call. You may have a protocol built out that already has maybe the contact lens assessment plan in it. So that's where you can choose, what level of, contact lens fit that you want to charge that patient. And if you have those levels set up in the, practice management side, then you can select that level in that plan. So let's go look at the contact lens assessment plan. So my myopia diagnosis does not have a contact lens assessment, but I gave the patient, trial lenses. So I want to make sure that I have that code, for that contact lens fitting. So I'm going to go over to the right of my myopia, add plans, and I'm going to type in contacts. So you're going to see multiple plans here. So you have contact lens assessment, you have contact lens fitting, you have a custom code contact lens fitting plan here as well as there's some custom code you're trying to use. So I'm going to show you the difference between these two. So I'm going to choose contact lens fitting, and I'm going to choose, where did it go? Go and do my contact lens assessment plan as well. I'm going to show you the two different ones if you're not familiar with both of these or either of these. So I'm going to save it. It's going to pull it onto my diagnosis here. So we have a contact lens fitting plan and we have our contact lens assessment. So what the difference is when you use a contact lens fitting, you can see already that it's telling me CPT code 92310. So over in the practice management side, if you have your 92310, maybe you're like, I don't charge different fees for contact lens fittings. I charge the same thing for every, no matter what type of fitting it is. Maybe you want to just use the 92310. You can use this contact lens fitting plan. Also, there's additional fit codes in here that if there's, if you're doing specific type of fitting, if I click on resume here, let me open it up. And you can see right here, there's a procedure drop down. So it defaulted to a 92310. And then I can click on that drop down. So if you're doing like a 92072 for keratoconus, this is where you would find that code. If you're doing, a 92312 or 313. So you can see the different codes here. So if you've ever been looking for any of these codes, this is where they're located in the contact lens fitting plan. Because I know sometimes doctors will say, hey, well, how do I document for keratoconus? It is right here. 92310. Like I said, if you're just like, I only have one charge for a 92310. Maybe I don't have like 5 different, fees for new patient, established patient, for the different types of contacts that patients are getting, RGP. If you do have different fittings, pricing over in your practice management side, you do not want to use this plan. You only want to use it if you're needing to code for the 92311, the 92313, the 92072 here is when you'd want to use this plan. Okay, so I'm going to cancel out of this. And then, if I was using this one, then I could check off things here, go over to the side, fill things out here. Now, I know we always get the question, well, it says assessment in here. You can put an assessment in here, but it does not count towards that area that I showed you when you're doing the contact lens trial lens or contact lens final RX and you want to put an assessment. You can put it here, but you definitely want to make sure you put it into the assessment when you add in the contact lens trial into the vision summary section. You need to do it there. I wouldn't worry about, having to look at this and be like, oh, I got to do this too. You can, because you can see this defaults to good, comfortable here. So you can definitely update it in here as well if you would like to. But you need it to be documented in the vision summary and you need your plan. Okay, especially for billing, because this is mainly what the plan is for. Make sure you're billing out. Put your assessment in the vision summary section. Okay. All right, so let's go ahead and cancel out of there. And then let's talk about the contact lens assessment plan. So your contact lens assessment plan is where you can tell the system, hey, I want to charge this patient for a level 2. Maybe my level 2 is for a established patient. Then the doctor can choose level 2 in here. Maybe your RGP is a level 3. The doctor can choose the level. So when the doctor sends the charges over, especially when you're using Encompass as a whole, you're using the practice management side, you're using the EHR side, then these levels will go over and link up to your charges that you have activated over in the admin side of practice management. So it makes it so much easier on whoever's invoicing the exam as well. It auto populates that fee. It's, pulling the right level based on what the doctor is documenting over here. So I'm going to go ahead and resume this plan. And mine defaults to a contact lens, no charge here. So if I click on this drop down, you'll see all these levels we have. So like 25 levels. Hopefully you do not have 25 levels of different, contact lens fittings fees that are set up in the practice management side. But, if you're like, yep, I have like 5 levels and this patient, it is level 2. The doctor would select that and then select done. You can see there's fit, comfort, vision, all of that listed here as well. But as I've already said, you can document it here, but you definitely want to document it in the vision summary section with that contact lens prescription. Okay. All right, so then dollar amount here, you do not have to put a price. You should have your prices over in the practice management side. So when that code is pulled into the exam invoice, it has the appropriate, price on it. Okay, and then I'm going to click on done here. All right, so I have everything documented here. So now let's go ahead and take a look at our billing to make sure that looks good. So now I can see I have my 92014 here, I have my 92310, and then I have my 92015 for my refraction. Now you may have the question, why does that only say 92310 when she just selected level 2? So over here in the EHR side, it is always going to say 92310. It's not going to say 0.2, 0.1, 0.3 like it says over in the practice management side. But when the doctor sends this over, it does see what level the doctor, had selected on the exam when the charge comes over. And we're going to see that in just a few minutes. I'm going to send these charges over, and then I'm going to hop back over to the practice management side. All right, so that looks good. Doctor sends the charges. I'm going to go up to the top, send my fees. And then, of course, I can send my RX if I have a final prescription, and I did create a final contact lens prescription, so I could send my RXs as well. So let me go ahead and click on that and send that. All right, so that is the EHR side. So now let's hop back over to our practice management side and take a look and see what came over. Okay, so I'm just going to go to my Rachel Ray patient. And then I'm going to go to exams, but I also see that I have a pending exam here. So anytime your doctor sends over charges from the EHR side, for that exam, for that contact lens fitting, for that refraction, it is going to say you have a pending exam. If I were to select price now, that's going to take me directly to my pricing screen, to that fee slip. If I click on pending exam, that's going to take me to my exam area where I can make updates, or I can see exactly what the doctor, sent over. So I'm going to go to exams over here. That's another way you can get to it, because I just want to see in this exam area, is my exam listed there? Yep, and here is my exam that I just did. So look at there. It says 92310.2. Even though in the EHR side, it did not show that 0.2, but when it comes over, because when the doctor selected that level in that contact lens assessment plan, then it does send over the level 2 code over here to the practice management side. So I'm just going to click on this exam. And then we can see everything that, pulled in. It has all my fees there because I have everything priced over on my administration side for my contact lens level 2. And you guys probably know this. You can go in here and say, oh, well, actually, doctor chose something. It needs to be updated to level 3. You can change that here as well. All right, so everything pulled over. I'm going to save and price exam. And then apply my insurance here. And this is just throwing in a little tidbit. If you do not know this, make sure that any item here that you do not want on that claim, make sure you uncheck it here. For example, if the patient was responsible for their contact lens fit, and maybe that's not something that was covered by the insurance, then I would uncheck that to make that solely out of pocket from the patient. Now, if I go up to my insurance, I can see right here that I have like contact lenses here. I know with my patient, they were covered for contact lens services. So I'm going to leave that checked and I'm going to click on that. And then I am going to calculate benefits and it asks me if it's elective or medically necessary. And then it calculated my benefits. The patient owes $70 out of pocket. And I'm going to save it and save an invoice. And now I've completed, everything for this patient. And let me just put this in here. Oh, I didn't want to deal with that. Oh, let me take this out because I have an extra invoice down here at the bottom that I didn't want to do anything with. And then there's my recall. I'm going to cancel out of that. Of course, you guys don't want to do that. Of course, you want to add your recall. All right, and there's my exam, and it's billed out to VSP. So, the main points of this, that we wanted to go back to a little bit is making sure, on the EHR side, when, the doctor or whoever's documenting that contact lens prescription in there, make sure that assessment is documented with that contact lens prescription, and then adding that appropriate plan that you need for the contact lens fitting, whether it be the one for the contact lens assessment that you need to use for any of the different levels that you're charging patients for, and then like the contact lens fit. If you're like, yeah, we only have the 92310 because we always charge the same thing for fits, no matter what type it is, then you can use that contact lens fitting plan. Or if you're doing something for keratoconus for the 92072, make sure you're using that contact lens fitting plan to get that appropriate code. All right, well, that is what I'm going to cover for today. Linda, any questions that have come up?
Thank you, Tina. It does not look like we have any questions. We'll give it another minute, but yes, I would like to remind everybody that you can enter any questions that you have using that Q&A icon on the top of your screen. But yes, in the meantime, if you are looking for more training, you can check out our other learning options such as documentation, tutorials and walkthroughs, role-based training, additional training webinars, and one-on-one virtual training or on-site training and consultations. You can learn more at eyefinity.com/education. I do not see that any questions have come in. So with that, I would like to thank you, Tina, for your time and for all of the valuable information you shared with us today. And also thank you to everyone on the line for taking time out of your busy schedule to be with us today. This concludes our presentation.
Thank you, everyone.